I'd like to start with this. And as a commentary, many of you have heard me talk about this before. It's to be rather than to see. It also coincidentally is the North Carolina state motto. When I talk about what we've been working on, where we're going, my expectations of myself, what you should expect from me, what you should expect from our nursing leadership team, as well as what I'm going to ask of you is that it's not going to be about chasing awards or accolades or making the numbers look good or how we appear to be. It's going to be about genuinely, authentically who we are, what we do, how we show up, and that the work that we're doing and the efforts that we're putting in terms of change, in terms of what we want ECU health nursing to be and to mean is deeper than the surface. I tend to keep this in my office somewhere where I can go back and reflect. So as we're talking about big major changes that we have coming or things that we're going to be putting resources into changing or trying to make right, this is where I try to anchor myself back to. Is our team going to feel this? Is this going to mean something to the people that I'm here to advocate for and represent? So we're going to start with just some basic things that we've been working on over the last year. And we've tried to catalog this, and it's a lot. And a lot of you have been a part of this, either directly or indirectly. So a lot of the work that we've been working on is even a nursing structure. I came here January of last year. Prior to that point, we did not have assistant chief nurse executive. We didn't have nursing represented at the highest levels of leadership across this organization. While there are individuals who are also nurses, they weren't there specifically to represent the interest, the vision, the future for nursing in those arenas. I came in as a department of one with a lot for us to do, right? Create a nursing strategic plan, work with our team to define what does it mean to be an ECU health nurse and then start to put actions in place to be able to achieve that. So part of it's been trying to figure out how we even bring that structure together, how we bring nursing from across the health system together to create a common vision. So that's not one hospital. It's not just the medical center. It's all of our 9 acute care hospitals, but it's not just our 9 acute care hospitals. We have nursing represented across the continuum of care in this organization, ambulatory setting, clinic settings, non-traditional nursing. So you'll see that we're working very diligently to make sure that we're inclusive of all of nursing as we're working forward on our strategic plan and the initiatives in support of that. So we didn't have system level nursing goals prior to this fiscal year that we've just crossed into. Had operational goals in support of our strategic plan, but we didn't have nursing specific goals in terms of how we were going to achieve that. Things that, yes, support our overarching operational goals, but then also pieces that are going to be important for nursing to achieve that time of year. We created an MOU, so there's now launching a huge gerontology care nurse practitioner program, the college nursing. So they'll be working through a postgraduate certificate program and then a direct entry nurse practitioner program, which is important for us because it's about advocacy, right? And it's about access to care. And in a rural healthcare environment, nursing may be your only access to care. And the expansion of nurse practitioner programs is critically important to the future. Significant work around Claudie Lapsy in partnership with many of our other departments and key stakeholders. We saw that despite significant financial challenges in the system, we were able to activate and get compensation and adjustments for all of nursing. Massive recruitment event on site that we've now had 2 recruitment events with really great extended. We're expanding nurse residency so that regardless of where you enter this organization, you'll be a part of the residency program. It's not just the medical center now, and all of our new grad nurses will come in and have that same experience to support and lead up through their transition into practice. We did some changes around incentive reduction, contract labor reduction. The reason that we do those things to reinvest in nursing. The high labor costs that we saw with contract labor and some incentive rates that were outside of market, by being able to pull those back in, that's how we reinvest in nursing and we're able to make market adjustments. And that's how we're going to be able to continue to be able to make those market adjustments. And that's part of the work that we do as nurses in terms of financial stewardship. Created a nurse executive fellowship. Excited about that. And that's part of our succession planning and making sure that we're preparing our next round of nurse executives to be able to seamlessly move into those roles. We did a retreat for all of our nursing executives across the system. We did a nursing summit last year. We've launched a massive research project. We created the nursing scorecard. We're able to drill down into that now and see where we're performing from a nursing perspective. And if you don't have access now, you will soon have access as we get that completely refined. We also have the ability to be able to drill completely into our workforce now and see where our nurses are. Where are they in terms of years of tenure? Where are they in terms of certifications we'll have in there? Where are they in terms of age, gender, all of those sorts of things that might inform how we better meet our teams where they are and identify opportunities based on what we can see within the demographic. Nursing branding and communication strategies. So that's really, if we're going to tell our story, and there's a beautiful story to be told here for ECU Health and ECU Health Nursing in particular, how do we go about doing it? And we can't do it here in isolation. We have this incredible best practices going on here in a very challenging environment. So we have to share that. It's also part of our profession, right? Sharing best practice, disseminating our learnings. So we have to be able to tell our story, not just on a local arena, not just at a regional arena. We need to be represented at the state and national level in terms of making sure that ECU Health is seen. And we have, the 12th largest academic medical center in the country, and most of the country has never heard them. That's part of our role as advocates in as nurses to make sure that they know about us, they hear about us, and they want to come and see what we're doing. It works through our shared decision-making reinvigoration, and I'm really excited to share some of that with you. The work on being able to forecast staffing further in advance so that we get out of some of our major reactions. And then we created our nursing extra program. So with 30 extra starting. Lots more has gone on. You've all been a part of really, really, really great work. But when we look back and reflect, I think sometimes we move on to the next thing. I'm guilty of it. We don't always take the time to really, wow, we did do a lot in the last year. And there were great outcomes that went along with that. This is part of the structure that I was sharing with you earlier. I do serve as assistant chief nurse executive, which means I represent all of nursing, not just the hospital nursing, not just those nurses that are at the bedside, but all of nursing for the entire population. So I brought on Maria again. She's a VP of Strategy and Innovation. So she's been pivotal in helping me work on both our strategic plan and vision, but a lot of the research that we've been doing to help inform what that strategic vision is. She's been working a lot on the branding and other pieces that we're working on, our digital presence, along with Qualcomm to make sure that we have our message out there and visible. Lots more to come there. And that's just the scratching the surface of the work that she'll be involved in. Laura Griffin, our new VP of Nursing Operations, has joined us. So a lot of the work she's going to be doing are the things that you're going to feel every day, right? So it's going to be making sure we have a really robust flow pool that can deploy and address in the moment needs, as well as needs that maybe due to FMLA and that sort of thing. She's going to be working through our observer program. She's going to be working through our contract labor strategy. So a lot more of the tactical day-to-day operational things that are system level initiatives she's going to be helping with. And then our VP of Nursing Excellence, many of you know Daphne was in that role. She retired at the end of the calendar year. So we've been working through the recruitment and interviewing process for that role. Got two really, really, really amazing candidates from across the country that have interest in being here and being a part of our mission. And I think that speaks to, frankly, the culture that you all helped create and are a part of, that people are interested in being a part of that. So my goal, we do our last interview actually this Friday. So my goal is to have a decision made by the middle of April and most likely have somebody in place by the 1st of June, be putting out some announcements about what that means. This is a really important goal. So right now I serve as the system chief nurse. I survey as the chief nurse for the medical sector since May of last year, and will continue to do so right now. I'm in the VP of Nurse Excellence position, so that's nursing policies, nursing practice, being involved in a lot of things that I'm involving myself in right now. So our med surg back, our supply chain pieces, partnerships with lab as we look at standardization of our IV pumps and interoperability with our EHR to help reduce overburden and nursing, and all of those major sort of clinical projects. That person's really going to be that clinical expert assistant level. Also, as we work through shared decision making and potentially other designations for our hospitals across the system, that person's going to really bring that area of focus to and the third leg to the stool of all the amazing things with everything. So, and I shared, we do have nursing goals. A lot of them are the things that you would expect from nursing goals, right? Body collapse, pressure injury. Last year, we saw a 23% increase in body, 34% decrease in collapse. The area that we have still tremendous opportunities around our pressure injury. And there's a lot of work underway. It's not any one thing, right? There is a piece of this that is absolutely positioning and mobility. There are pieces of this that are related to our bed services. It's related to the supplies that we have around our TAP system. It's making sure that nursing is going to be present in terms of identifying what our challenges are and work through what those initiatives are going to be, help change the trajectory that we've had, which is increasing pressure injuries year over year over year over year. So I feel very hopeful about this one. It is a large lift, and there's a lot of work that's going to go on. And we'll talk more about where you intersect with all of these things as a little bit further. Falls with injury, muscular overhaul. Again, a lot of work going on around there. PE and HD. Star ratings that you'll see in our nursing dashboard, while star ratings are the outcome, we're focused on nursing communication. And so that nursing knows how nursing is performing because the star ratings are so lagged. Reduction in turnover, and we'll talk some more about turnover. And then our role in the financial transformation, which is how we deploy this financial stewards and make sure that we're contributing. Most recent work, a lot showing on. We've rolled out the daily management system. So the daily management system really is a system level initiative. It'll be something that's in place in all departments across the entire health system. We started with nursing because you guys are fabulous and innovators and used to that sort of a huddle where you're focused on what we need to accomplish this shift in order to be able to start drive change. Also, we have a little bit of a site survey coming up. Any idea what that is? So we had certainly the pressure of needing to be able to sort of, I guess, have a board that served two purposes, right? Certainly allowed us to be able to share the things that we know we need to share as part of an Atlanta organization, but also rethink that board in a way that it's directional, it's actionable. It is something that could be translatable beyond the nursing. So excited about that. We launched our team patient value stream analysis. We did that last week. Once again, really great work that will be tied to how we change processes, how we make sure that we have the right things where we need them, when we need them, how we need them. Ultimately, when a value stream analysis and the mapping and the projects and support of those things are done right, you see improved flow, improved outcome, better financial performance, all of those things. But the biggest piece to me is the reduction of work on our teams. All of those processes that are a pebble in your shoe that you have to rework and do over and over and over again, where you don't understand why there are 20 steps to get something done that should take one step. It's going to be focused on the reduction of those things. And a lot of the focus that you'll see both for our team members as well as for our leaders is going to be focused on how do we reduce overburden? How do we leverage technology, innovation? How do we work together? How do we determine where work really should be done? And nursing doesn't have to own every bit of it. sometimes we're guilty of saying, I got it, and we just take it. And other times, because nurses are here 24/7, they end up with that as sort of a default. So we'll be working through that. Our research project, and they get into that a little bit more. We've achieved finalized the work there. We had a mock magnet survey here at the Medical Center, gave us some feedback to make sure that we are ready to go for day of surgery. Another great recruitment event. And then we have our first shared decision-making day that with our new shared decision-making council. Many of you were there, many of you helped to create that vision and to rally our teams in terms of their engagement and involvement in that. Things that we're continuing to work on, increasing our state national presence. We just had really great representation at the North Carolina Organization Leaders Conference. 9 posters, including the Louisiana for Best Evidence-Based Practice Project. And I think it was certainly surprising to some of our colleagues in different colors that our purple was so very, very, very well represented there. And we'll have a nursing leadership coming up, the Nursing Summit. You have the opportunity to come to this event. You should not miss this. It is going to be really phenomenal. We have 3 big keynote speakers that will be there over the course of the 2 days. If you can't attend both days, you can attend a day. And that will take you straight to that and help you determine where you want to, what day you can attend and request to secure your seat. We've expanded it over 2 days because we really should want our teams to come. Sometimes when we have these events, the same people get to show up over and over and over again, either because their schedules permit them to do that or they have the leadership support to do it. But we really want to make sure. So please talk with your teams, talk with your colleagues, ensure that you're sharing that we have this going on. There's fees attached to it. It's really going to be an amazing event. You have some speakers from all over the country, nationally known, and it's very future focused. It's going to be content that they have not heard before, that they haven't probably gotten an opportunity to see before unless they've been attending national conferences across the country. I think it's important to get that sort of energy going and thinking among our teams in terms of what we want the future to look like. So often we limit ourselves based on kind of where we've been and where we are currently. And I feel like get the team really inspired and thinking very differently in terms of what we want the future to be and how we get there. Have the nursing annual report. So this will be the first for the health system coming out the 1st of May to coincide with May 6th to come. Thursday. So that'll be coming out, a celebration of all things nursing, and lots and lots of pictures, lots and lots of recognition of our teams and making sure that we're very inclusive of nursing across the system. This is our first attempt at it, so be kind. And as we continue to grow and evolve and not feel like we have every project to do right now, it'll get better and better and better. But I'm really excited about it. There's been a tremendous amount of work that's gone into it. Or it's going to be working by float pools, internal travel program, the observer program, and make sure that we have that working in a different, more efficient way than it is currently. Working for a nurse assistant role, clinical ladder. I've heard that one loud and clear, and I'll give you some thoughts on what the future of that looks like. I will say, when we first started talking about rebuilding shared decision making here, I asked, okay, what does everybody think the barriers are? And they're the traditional barriers that people throw out there. And it's schedule and it's time. But almost everyone said clinical ladder. Until you have a clinical ladder, you're not going to be able to rebuild shared decision making. And I said, well, but why? So if someone sees value in something and we make sure they have the time to be there, does it another $1 an hour or $2 an hour in a clinical ladder, is that really your motivator to be a part of shared decision making? And if that's your only motivator to be a part of shared decision making, are those individuals we want involved in shared decision? It's not that compensation isn't important and we're paying people to attend those meetings and we're going to recognize the people who are involved in that work. So does it have to be in place in order to engage our teams in a different way, in meaningful work? And ultimately, the answer was no. We secured a day that became the day for shared decision making. We blocked that time. We worked with our leaders to make sure that they scheduled in advance. They know it's predictable. It's every 6 weeks is shared decision making. So it works with our calendars, right? So we've got a scheduled period of 6 weeks. That shared decision making day falls on the same day each 6-week period. So we can plan for it. We can staff up for it. We can make sure that our teams are able to go. And we've gotten great participation. A clinical ladder is important, but I think for reasons that are different than how we've looked at that historically. It's been a way that we've been able to compensate somebody, but it ends up becoming very transactional. And if I go back to our very first slide, to be rather than to see, we don't want to create situations and processes that are transactional. You do this, therefore I give you this. We want people engaged because they know that that work is impactful and powerful, and they're going to make a difference, and they have a say in their practice, and they have a say in nursing processes and the equipment to choose and the environment within which they work. So the clinical ladder is important, but not in this transactional, you fill out a portfolio and check all these boxes and you sign up to do these things just because it's going to make you a 1, 2, 3, or 4. The clinical ladder needs to be our investment commitment to an individual who's wanting to commit and invest in different ways and continue to grow within this organization. Doesn't mean they have to go into leadership. Doesn't mean that they have to aspire to do a role any different than they're currently doing, but it's how we support them. It may be making sure that we're investing in them and that they have membership in a professional organization and we're taking care of their certification and we're making sure that they go to conferences and they have access to educational opportunities and they're involved in committees and we're making sure that they have the time and we're investing in them in that way. So that clinical ladder of the future, to me, once again, it's one of these areas where we have an opportunity to innovate very differently in terms of how we've done a clinical ladder in the past. We don't need to take what we had in the past, dust it off, and be once again married to this 1, 2, 3, 4 thing with a bunch of check boxes. So the team that works on that, they're pushing really, really hard to think differently to make sure that we're engaging our teams and understanding what they want to be involved in, what is profoundly meaningful to them, and how we work together to create a clinical ladder. Shared decision making expansion. We've done great work. Thank you to Stephanie and the team that helped support getting our councils back up and risen from the dead, I would say, or some places. So thank you for everybody's work on that. Now the question is, what does shared decision making look like from a system perspective? How do we ensure that our nursing team across the entire health system has access to the very, very highest levels of nursing leadership, their voices are heard, and that we're able to also communicate with them? So that'll be the next piece of this. Enhanced and expanded academic partnerships. That MOU with the College of Nursing at ECU is just the very beginning. There's so much more that we can be doing in terms of partnering from an academic perspective, from a faculty perspective, from making sure that the schools that we help support with clinical opportunities, we're supporting the students to the very, very, very best level, but that there's also an alignment. If we have a vision for where ECU Health needs to be, the academic institutions that are help supporting us in terms of a pipeline of workforce, we need to make sure that they're aligned and those students will be prepared for what the future is going to look like in nursing, which is very different than what our past has been. And then expanded recognition programs. Part of what we're hearing, and it's no surprise to anyone, has anyone ever gotten an e-card that, went out to 100 other people? How did it feel? Did you feel special? I think
it's that thoughtful recognition and figuring out how we do that. And how do you scale that so that 4,000 of us are feeling it, right? We represent 25% plus of the workforce here at ECU Health. So that's the challenge, right? We take advantage of having these tools to be able to get information out, to be able to extend recognition, but it doesn't feel necessarily always personal, specific to the individual, in a way that they feel seen. So those are the things that, as we work through the recognition programs for nursing moving forward, Daisy's a great example. But it's small compared to sort of our greater workforce in terms of those who end up recognized. So we'll be working through additional ways that we can do that and be meaningful and intentional about it. So our shared decision-making structure, sort of for those of you that haven't been involved in this work before, we have the Coordinating Council. I am a sponsor for the Coordinating Council along with Nikisha Barr and Stephanie. We have Beth, who's continued to stay on as our chair. The goal of this council really is the other councils report up in terms of what those councils are working on. We make sure that we have good, strong, functioning representation in those councils. We help create the vision and the goals. A lot of our work is very much going to be around advocacy in nursing, making sure that we have representation, that we are identifying opportunities for nurses to sit on boards, to sit on committees where maybe nurse representatives are either not present or underrepresented, and we need to make sure that we have a seat at the table. We have our Professional Development Council, very much focused on the growth and development of our teams. The Nursing Environment Council, which is one I'm really excited about, because when we start to get into these subcommittee works, the nursing environment is everything, right? It's what we find ourselves in day to day. So that council has basically the runway to tackle any number of things. It may be workplace violence and initiatives and things that we can employ to be able to help address workplace violence. It could be overburden in nursing. It could be incivility in nursing. The nursing environment, to me, is very broad and deep. And the ability for this team to be able to truly impact how we feel at the end of the day going home is profound, because they're going to be leading it from the front line. They know what's going on a day-to-day basis, and they are best prepared to be able to share with us where the challenges, the barriers, the concerns are, but also help us identify the solutions. Then our role on the Coordinating Council and as nursing leaders is to help them get the resources, remove the barriers, and say, run. We're going to support you. So very excited about that one. Nursing practice, obviously, a cornerstone of what we do, making sure that nursing practice is well represented, that we have mechanisms in place to make sure that our team is within their scope of practice, but most importantly, performing at the top of their practice, and that nursing practice has a voice in all things that will impact our work and our practice. So excited as those subcommittees start to get formed and identified. They are just now identifying what their goals will be. I have a goal for the Coordinating Council, and I'll share it with you openly. I haven't shared it with the Coordinating Council yet, so if you're here, surprise. One of our roles is supposed to be advocacy. Well, the board for ECU Health Medical Center, we've had some changes in board members over the years, and we currently do not have a nurse on the board of directors for ECU Health Medical Center. So my goal for the Coordinating Council is going to be to work to form a professional letter urging the system to actively seek a nurse for the board for the medical center for the next vacant seat that they have. So we'll continue to lean in on that. We'll also be working to identify opportunities for our team to serve on other boards across the both the state and the nation. So our professional practice model, this is for you, Stephanie. I am guilty of not always putting this up there, and we're going to work on a prettier aesthetic for this, but given the fact that we are less than 2 weeks away from our magnet redesignation, and that this is how we connect as nurses and really the foundation of what we do, it was important for me to include this as a slide. I think it's important that we all sort of reflect back on, within this professional practice model, what are we doing every day to show up, to drive this? How do we contribute? Because we're doing all of these things, and we don't always pause long enough to be able to think about it and to connect back to what this professional practice model outlines. It's also going to be important for our teams, for all of us as the surveyors are here, to be able to speak to that. And it's hard to do if you don't pause long enough to think about it. I will say this has been a solid professional practice model for us. Where we're going to be asking the team moving forward is, does this still resonate? And do we need to reevaluate our professional practice model? It's not mine. It's not leadership's to own. It's our nursing teams to own. As we get through this cycle with magnet redesignation and we start to talk about the shared decision-making model and the professional practice model for the health system, we're going to be looking for input to see what resonates and what really is relevant at this moment in time and for the future for ECU health nursing. So let's talk some more about the future and where we're going. So as nurses, we are natural advocates, leaders, and innovators. And this is the space where we all have an opportunity to contribute in a very different, profound way moving forward in challenging ourselves internally, in challenging our teams in a respectful and inclusive way, and in challenging kind of the constructs within which we find ourselves and how things have always been done. And this is the space where we're going to have to lean in as we create the vision for nursing moving forward. So this is the vision for nursing. I put together a small group to create what is that strategic vision for nursing, and what do we want the future to be? What does it mean to be an ECU health nurse? Obviously, our mission is the health system mission. Our vision is to become the national model for nursing excellence, innovation, research, and education in rural health and beyond. As we work through the scope for where we were going, it's a broad scope, and this includes everything from our workforce, how we develop them, the kind of environments that we create within which they work, how we innovate to streamline processes, to reduce overburden, how we think of our staffing models now and into the future from a quality perspective, how we're really truly leading in that space, right? How are we identifying and adopting best practices, the experience for both our patients, our team members, and the environments within which we all have to work, and what that needs to mean into the future. Research. It's an area where I feel like we have done pockets of research, and a fair amount of what we have been doing has been driven by those who are in graduate programs, right? We all did what we needed to do to get through our master's program or our doctorate program, and many never looked back and have not re-engaged in research since. I was in awe when I arrived at the number of doctorally prepared and graduately prepared nurses within this organization, but it's almost inversely proportional to the amount of research that we're putting out. And part of that is, yes, I'm not even going to speak the words, but the last few years that we've been through, certainly that has had an impact on any number of things. The other piece to this is, how do we make it friendly, right? IRB can be intimidating, especially if you haven't been through it before. So how do we create a front-end process that inspires our teams to go in with a question? Here's a problem I'm trying to solve. Where do I even begin? We've got to create a front-end process for our nursing teams where they're able to do that, and it then can launch them into being involved in research, which then needs to lead to publication and presentation, right? It's not just enough to do the research and to potentially make an improvement maybe on one unit here. We've got to spread it across the organization. We've got to share it with our teams, and then we've got to spread it. We've got to share it at conferences. We've got to publish it. So a lot of the work we're going to do around research is very much focused on that. And beyond that, what are the problems that we're trying to solve? And have a catalog of things that we know we're going to need to work on and stimulate some conversation. So if somebody's seeking to do research, they don't necessarily have to start from scratch and come up with some idea that may or may not really be aligned with what the needs of the organization are, and that we're able to help them with providing opportunities, or at least the beginnings of something that they can take and run with. Governance, I shared a lot about this already. Financial stewardship, and this is a part of our role. This is, like I said, how we continue to reinvest in nursing. There are always challenges when you make market adjustments, when you make compensation adjustments. There are those that are included, there are those that are not over time. The goal is that all tides rise. The dollar numbers attached to infections or harms that come to patients are significant. The impact on length of stay has financial impact to this organization. But more importantly, the ideas and innovations that can stem from nursing can have a significant impact on this institution in terms of our financial performance. When we put financial stewardship down here as well, the other piece that I was thinking through is being able to tell the story of nursing from the value of nursing. So many health systems today are focused on the cost of nursing, and they're not telling the story of the value of nursing and how we contribute in such a meaningful way. There's a lot of conversation nationally now about changing that, right? If you're being reimbursed for nursing the way we're reimbursed for other providers, perhaps that story would be different, because we are considered a labor cost rather than revenue generating. I beg to differ. We are generating revenue because by virtue of being here, that's the only way the work would be done, right? So we have to be able to tell that story. And that's why it's so important that we have nursing representation, that we have nursing voices, that we have nursing advocacy in every nook and cranny within the health system, within the state, within the nation, advocating and sharing those stories. So when I say financial stewardship, I don't mean hit your productivity target. Yes, I'd like you to hit your productivity target, but it's a much bigger picture than that. And then marketing and branding. And by marketing and branding, it's not just, oh, what does our logo look like? What font are we using? Because Marcom decides that. We don't get to decide on our font. I mean our presence locally, our presence at the state level, our presence nationally. What does it mean to be an ECU health nurse? How are we telling our story? How are we out there and digitally accessible to anyone that might want to know about what's going on at ECU Health? What are we doing to be on that national stage from a publication perspective, from a presentation perspective? How are we elevating our nursing team from all walks of life across this organization to be visible and present and seen? It also needs to be, how are we communicating internally? Today, I can't send an email to every ECU Health nurse. It doesn't exist. But that's also, as we all know, not the best way, because how many times do you have to log in to get to your email? And emails at some point, it'll go the way of fax machines and pagers, which we still seem to be holding on to in healthcare. So we have to find other ways to continue to communicate with our team. So that means events like our nursing summit, nursing town halls, being out and present and rounding, also being able to leverage digital communication to be able to reach 4,000 team members across 29 counties in an area larger than the state of Maryland. We'll be continuing to work on that because that's always the biggest challenge, communication. I'm really excited about this. As we started to work through the strategic plan, like I said, we have our vision, we have our scope, but as we started to talk about, okay, how do we put some meat on the bones of our strategic framework? We were missing something. We had some great representation who I feel were very much in touch with nursing, but our frontline nursing voice wasn't heard. We could have tackled this a few different ways. We could have tried to ask a few nurses. We could have rounded. We could have asked them to give us some feedback. We could have sent out a survey. We could have pulled some of the data we had from experience surveys and other things to try and help inform what the strategic plan looked like. Or we could be big and bold and push the status quo and do something that hasn't been done in the country before. And that's what we did. So we launched a massive research project, and 40 of us became trained as PIs. So we're putting our money where our mouth is. If we're asking our teams to do research, we're going to do research too. So 40 of us were trained, and we spent many hours traveling across the entire health system in a variety of arenas: critical access, academic medical center, ambulatory, non-traditional nursing roles, shadowing our nurses, doing observational studies, being able to collect data as well as gain qualitative feedback in terms of the experience of nursing, the barriers they feel, and help inform what our strategic plan will be. So we finished that part of it. We now have focus groups, which are almost done, that we're bringing together and gathering more information. We'll be synthesizing all of that to help inform what the nursing strategic plan needs to be. I'm really excited about this. It was a tremendous amount of work and a lot of investment from many people across nursing to be able to make sure that we stayed with this and did it right. And honestly, some really great times with our nursing teams. I enjoyed it most because, of course, we all went out and we were there in black scrubs and we introduced ourselves, and my badge says Patricia RN, which no one calls me. I went to areas where they didn't necessarily know me or hadn't seen me before. And it wasn't until the end when they'd ask, so where is it you work? And I thought, this is wonderful, because I knew I was getting a genuine glimpse of what their day was. And the funny thing was, we had over those hours, we had developed a rapport and enough of a relationship that they weren't freaked out that I had somehow been sneaky about who I was, because that wasn't the intent. The intent was to be able to get a genuine experience from them. And selfishly, I wanted to be a part of the research. I wanted to be out there and talking to our teams and hearing what they had to say. And they were wonderful. Our teams are doing amazing things, as you all know. And genuinely attached to being rather than seeming, and wanting to do the right thing, but in an environment that doesn't always allow them to be their best or do their best. So that's my number one job, right? Advocating for nursing, making sure they have what they need, when they need it, how they need it, that we're supporting them in a real way, that we're creating a vision with them, not for them, and that we're being intentional and clear. I'm by no means perfect. I can name far more flaws than strengths, and I'm going to make mistakes. We're all going to make mistakes, but if our heart is in the right place and we're working together to get toward that vision, we're going to be far more successful than I would ever ask, or I think anybody else would ever ask of us. So we should have finalized this. We'll start to work through the analysis, and I'm excited to be able to share this in future town halls coming up in terms of what that ends up looking like. One of the other research projects that we ended up a part of, sort of concurrently with this, is we worked with an organization called the Health Management Academy, along with the American Organization of Nursing Leaders, on a research project specifically focused on our nurse managers, span of control and reducing the overburden for our nurse managers, because we know that the impact a nurse manager has on a nurse working for them is significant. How they feel supported by their leaders can change how they feel about the organization, good or bad. And how a nursing manager shows up is on us. It's on us to make sure that they're appropriately prepared, they're appropriately supported, that the things that we're asking of them are reasonable, and quite frankly, that they're also empowered to be able to uplift their teams and grow their teams in a way that supports them, and the entire community unit, facility, system is working together and it doesn't all fall squarely on the shoulders of what I consider to be the hardest job in any hospital, which is a nurse manager role. So big things we have coming. April 15th to the 18th, we have our magnet survey at the medical center. We'll have 4 surveyors for 4 days. It's a time of celebration, guys. During some very challenging years, they're coming here to hear what our teams have to say and for them to share the great things that they're doing. I'm very optimistic about the surveyor. We've met several times with the lead surveyor, and she's just a joy to behold, and quite frankly, in her 70s and just still a force to be reckoned with. So I think she's going to be really excited to get to see our teams. They will be very tired by the end of the week because they have a lot of square footage to cover. But we have the calendar set. So please, we'll be working with our teams to make sure that those that are requested to be in sessions are there and available. Our teams just need to be prepared to share what they do, make sure that they understand the stories that were told specific to their units, celebrate what they do every day, and share what it means to be an ECU health nurse. So I'm excited about that. May 1st, like I said, the nursing annual report will come out. May 2nd and 3rd, please register if you're able to attend. And encourage your teams, your colleagues to attend as well. Nursing leadership retreat coming up. And then nursing has partnered with patient safety. Last year we had the safety innovation grants, and there were lots of them, and they were smaller grants. This year we've gone bigger and bolder, and we've partnered so nursing and safety working together to create what will be a safety innovation pitch day. So the top 5 will be brought to the pitch day. The top 3 will receive 20 grand investments in their safety innovation that they want to accomplish. The other 2 will receive conference attendance. So it'll be big, kind of a Shark Tank theme, sort of a vibe for those. But the great thing about this is with larger dollars come the ability to be able to potentially even bigger innovation projects. So rather than something that may be supported at $1,000 or $500 or something like that, we can think bigger and bolder. And I've already heard about some of the projects. The deadline for that is May 3rd. So if you need information about that, please reach out to any one of us. We'll get you that information. But and there has to be a frontline nurse involved in the project team. So that was the other piece that we made sure that the voice of nursing would be heard in these. So we've got a video for you all. APEX, Advancing Nursing Practice and Excellence. The word apex, meaning the top, worked well with the focus on the mountaintops in our achievement of excellence and a focus on the future for nursing. So it resonated well. The 2 primary elements, the hands coming together in a heart. The hands represent a couple different things. It's how we come together as a nursing team. It's how we come together as an interdisciplinary team to create a loving, healing environment. The focus that comes in with the heart as the hands come together is focused on the peak. It's focused on achieving excellence. It's focused on the future and how nursing defines that. The interesting thing about this icon is you wouldn't have the focus if there wasn't more than one hand. It would just be a single hand out there, and you wouldn't be focused on achieving excellence. You wouldn't be able to get there. So it's about how we come together as a nursing collective to design the future, and how we work collaboratively with our partners across the healthcare system in achievement of greatness. Mountains are not part of the Eastern North Carolina landscape, but this isn't the Eastern North Carolina landscape that we're trying to depict. We're trying to depict excellence. We're trying to depict the future for nursing. So it's less geographic and less literal and much more focused on the achievement of excellence and the focus on something that seems so big when you're standing at the foot of it, but when you're looking toward it, it seems like something you can achieve. We can be guilty of minimizing what we do, that we're rural, we're Eastern North Carolina. But I think that's actually absolutely the opposite. By virtue of being rural, we have to think differently. We have to be more innovative because we're dealing with a patient population with significant comorbidities, with social determinant of health challenges, and yet still we're able to compete from a quality and a safety and outcome perspective on a national level. If we can do it here and achieve that excellence together, then we are the national model, because nobody's doing it in an environment harder than we are. So anyone that knows me knows I hate pictures of myself, and I really don't like videos of myself. So props to the marketing team for phenomenal editing. So thank you for that. We felt like it was important because, an icon without context is just kind of a weird little picture, and we wanted people to understand the thought that went behind this. It's not going to be something that is necessarily slapped on everything, but when you start to see some things for nursing, if you notice on our intranet page, there's a logo for quality. There's a logo for the well-being department. There hasn't been something for nursing. So we wanted something that was representative of us, that felt genuine to nursing, but that maybe, it may be watermarked on some of the things we do. It may be on our t-shirts. There will be places for it, but we wanted something that we could tie our teams back to, but we also needed to explain it. My call to action to you. So these quotes were top of mind for me actually earlier today when I added them in. So I attribute my success to this. I never gave or took an excuse from our dear friend Florence. She was a tough lady. It did some really amazing things. And I don't normally quote Florence, but I want to be able to live that quote. I want to tell you that I'm going to make mistakes, but that I'm putting nursing at the forefront, that my goal is to advocate for this team and to be the voice where we need one. I won't always get it right, but I'm not going to make an excuse. If we fall short, if our timeline isn't what we thought it was going to be, if our outcome isn't what it's going to be, we're going to pick ourselves up and we're going to come up with another plan and we're going to move forward. I'm not going to make excuses. I'm going to be here to work alongside you. And that's my expectation too. As nurses, we're not going to make an excuse. We're going to solve the problem. The first Black woman U.S. Congressman, if they don't give you a seat at the table, bring a folding chair. That should be the charge for every nurse across the nation. As we're talking about making sure that there aren't decisions made about nursing without nursing, this is regardless of the role that you play in an organization. You are a nurse first and foremost, and these chairs fold, ironically. So we'll just take a chair with us if we're not at the table, but I will certainly be advocating. So what this means, we had teams show up to shared decision-making day. 80 people joined councils, an overwhelming response to my call to say, be a part of the change, to become what we need to become in terms of the national model for rural healthcare and beyond. We all have our part. That means being bold. It means stepping out of your comfort zone. It's meaning when there's an ask for representation for something, leaning in, even if it's maybe not something that you would normally do. It means making sure you're part of your professional organization. It's making sure that you're out there and sharing the story of nursing, that you're advocating at the national level. You're going to see a lot of this at our nursing summit the first part of May. So it's about advocacy, it's about innovation, it's about helping create the future with us. So we need to challenge our teams, we need to challenge ourselves, our colleagues, to be a part of things. Because the other quote not up there is, if you're not at the table, you're probably on the menu. So let's make sure that we're well represented and that we're creating the future we want, because if you don't, you can't complain. If you don't like what you see, you need to be able to provide your input along with a solution. And I'm all about it. If you've got solutions, if you've got things that you want us to work on and you've got an idea how we can tackle something, we want to hear it. So we're creating this vision, this future, and putting the actions attached to how we're going to achieve it for you all to be a part of that. So, and I think I finished right on time, which is not on time. Thank you for attending.
Thank you.